This presentation covers our ANA line immunoassay, which is the world's largest relevant ANA profiling assay. The product is called as ANA Maxx. We covered in the previous presentation that one can use an ANA HEP 2000, which is an excellent screening assay. An ANA HEP 2000 will either come positive or it will come negative, which means a screening test will tell us whether the result is positive and there is likelihood of a disease, or the result is negative and most likely this is not a disease. However, as we covered in the previous presentation, that ANA is a screening test which covers a variety of autoimmune diseases. A screening test can tell you that you likely have an autoimmune connective tissue disease, but it does not tell you which connective tissue disease do you suffer from. For this reason, we need a profiling assay or the LIA assay. ANA Max is a test which is capable of detecting 17 autoantibodies on a single line blot. The kit comes as a strip made of nitrocellulose, like you see on the right side of this slide, and on this strip are coated 17 autoantibodies. These are all parts of ANA. As we said, ANA are anti-nuclear antibodies, which are a group of antibodies directed towards the cell nucleus. Even though there are more than 150 such antibodies, what we have done is the 17 most important autoantibodies we have coated on a single line immunoassay. In this case, you can see the name of these antibodies on the right. We will talk a little bit more about this in the upcoming slides. So what are the features of our assay? First, each test comes with an inbuilt positive functional control and a cutoff control. It is very simple to process, takes about 2 hours, and even one test can be performed at a time. That means you don't need to wait for a week, collect 5 samples and then run it. Even if you want to run it as a single test, it is possible to run it within 2 hours without any additional costs or wastage. Our ANA Max produces results that correlate very well with our ANA HEP 2000 patterns. It's quite an easy to run assay, very robust, and it's available in a convenient pack size of about 24 tests per kit. The kit, once opened, can be run for several months, maybe about 5 or 6 months. So even if a lab is getting one test in a week, there will be no problem in completely using the kit. This kit, ANA Max, helps in differential diagnosis for patients who are positive on an ANA screen. The most common connective tissue diseases include SLE, Sjogren's, MCTD, systemic sclerosis, and myositis. All these diseases can be diagnosed on the ANA Max. Additionally, our kit also detects certain cytoplasmic autoantibodies such as AMA, ribosomes, and JO1, and we have two new antibodies which are Mi2 and Ku, which help in picking up myositis and scleroderma patients, and these were previously not available on any blot. Just to give you a short summary, the first connective tissue disease of interest is SLE, also called as lupus. dsDNA, nucleosomes, SMD1, pCNA, and P0 or ribosomal antibodies, these are all found in SLE. We have a drug-induced form of SLE in which we find histone antibodies. We have a Sjogren's syndrome where we find SSA, Rho52, SSA, Rho60, and SSB. In scleroderma, we either find CENPB or we find SCL70. In mixed connective tissue disease, we will generally almost always find U1SN RNP antibodies. In myositis, we can find JO1, PMSCL, KU, and MI2. And in PBC or primary biliary cirrhosis, we will find AMA-M2. One of the very special things about our ANALEA Maxx kit is that we have an inbuilt cutoff control. In every strip, once a strip is completely performed, we will get a very weak cutoff band. All the other bands, if they are present, are compared to this weak band. If we find that the intensity of a test band is more than the cutoff band, we report it as positive for the respective autoantibody. This is quite similar to the cutoff control also used in many qualitative ELISA assays. This inbuilt cutoff control allows an excellent validation of the run because it adjusts for all the band intensity differences like temperature, time, operator. So an inbuilt cutoff control is a very useful thing to have on the assay, and this control is not available on the competition assays. So we are unique in the sense that we have an inbuilt cutoff control. Our biggest competition in this field is a company called as Euroimmune, which offers a line blot with 15 antibodies. We cover 17 autoantibodies, which includes KU and MI2, in addition to the 15 autoantibodies also covered on the Euroimmune blot. KU and MI2 are important autoantibodies found in myositis, scleroderma, and overlapping syndromes, and they typically appear as nucleolar or speckled or atypical speckled on the ANA Hep2000 assay. This means that before we were detecting KU and MI2 antibodies, we were often seeing samples which were ANA positive on the Hep2000 or the Hep2 but negative on the LIA because they were KU and MI2 positive. With the inclusion of KU and MI2, our ability to pick up antibodies increases and our test becomes more sensitive. Finally, in addition to our ANALEA Maxx, which is our star product in the LIA category, we also offer a cheaper version of ANA LIA called as ANALEA without the Maxx symbol, which detects 12 antigens. We also have a liver LIA, which helps us in picking up autoimmune liver diseases. A vasculitis LIA, which is an excellent tool for detection of ANCA autoantibodies, whether it's P-ANCA or MPO ANCA or C-ANCA or PR3 ANCA, and GBM, an excellent tool for nephrologists. And we have another LIA for gastrointestinal diseases like celiac diseases and pernicious anemia, which includes markers for TTG, gliadin, ASCA, PCA, and intrinsic factor. Now, while you might have found this whole presentation somewhat confusing because the terms are new for you, our strong recommendation is only on 2 points. A. Go through the presentation again so that you become clear on these concepts. And most importantly, any large or very large lab which is having a good practice for autoimmune diseases, all the labs where you are targeting ARES-epi also target LIA. Talk about ANALEA Maxx, use the ANALEA Maxx catalog, and please feel free to request and demand from your autoimmune product specialist who is located in your region to come and help you in promoting this assay.